Hey everyone, and welcome. Today we are diving deep into a topic that has completely changed millions of lives and really redefined what's possible for building a family. We're talking about in vitro fertilization, or IVF. So whether you're just curious, maybe you're supporting a friend, or even thinking about this path for yourself, our goal today is to break down this amazing technology and make it super clear and easy to understand for everyone.
So, here's what we've got lined up. First, we'll get into what IVF actually is. Then, we're going to walk through the entire journey, step by step. After that, we'll explore who can benefit from it, tackle some of your biggest questions, and finally, we'll put it all together to see the big picture. It's going to be a really interesting one. Let's get started. Okay, first things first, what is IVF, really? Well, to get to the heart of the science, let's start with a nickname you've almost definitely heard before, a phrase that totally captured everyone's imagination when this whole thing was brand new. Yeah, I'm willing to bet you have. It's a phrase that's been floating around for decades, and honestly, it sounds like something straight out of a sci-fi movie, right? But while it's super memorable, it can also be kind of misleading. So what does it actually have to do with a real medical procedure? Here's the deal. It's a simple but really important difference. Test tube baby is just a catchy nickname for the outcome. The wonderful, healthy baby born because of the procedure. But IVF, that's the name of the scientific process itself. And, spoiler alert, these days, fertilization actually happens in a super sophisticated sterile lab dish, not an actual test tube. The nickname stuck, but trust me, the tech has come a long way. Okay, so let's get official for a second. IVF stands for in vitro fertilization. That term, in vitro, is actually Latin for in glass. And that's because the whole idea, the core of it, is that fertilization, that moment an egg and sperm connect, happens outside the body in a totally controlled lab environment. This whole technique is a huge part of what's called assisted reproductive technology, or ART for short. All right, now we know what it is, so let's get into the how. What does the actual IVF journey look like? It's a process with a lot of moving parts that requires perfect timing, incredible precision from the medical team, and a whole lot of heart from the people going through it. So one full IVF cycle usually takes about 4 to 6 weeks from start to finish. It's a pretty intense period that kicks off with ovarian stimulation to prep the body. That's followed by the egg retrieval, then the embryo transfer a little later, and finally, the infamous 2-week wait for a pregnancy test. It is absolutely a marathon, not a sprint. We can break that whole marathon down into 5 main steps. First up is stimulation. That's where medications help the ovaries produce multiple mature eggs, way more than the usual 1 per month. Second, you have the egg retrieval, which is a minor procedure to collect those eggs. Third is fertilization. This is the magic that happens in the lab where eggs and sperm are introduced. Fourth is embryo culture, where the lab team carefully watches the embryos grow for a few days. And the fifth and final step is the embryo transfer, where one or more of the healthiest embryos are gently placed into the uterus. Now, during that third step, fertilization, sometimes you need to bring in the specialist. That's where this amazing technique called ICSI comes in. It stands for intracytoplasmic sperm injection, and it is just as precise as it sounds. A highly skilled embryologist uses a powerful microscope to inject a single healthy sperm directly into an egg. This technique has been a total game changer, especially for male factor infertility, where sperm might need a little help crossing the finish line. So we've covered the what and the how, which brings us to a really important question, the who. Who actually uses IVF? And you might be surprised because the answer today is so much broader and more inclusive than you might think. It's not just about one thing. It's about creating possibilities. A lot of people think that IVF is only for a man and a woman who are struggling to conceive naturally. And while that is, of course, a huge and vital reason people use this technology, it is definitely not the only one anymore, not by a long shot. Honestly, the reasons people turn to IVF today are so varied. It's a path to parenthood for same-sex couples and for single individuals who are ready to build their family. It makes pre-implantation genetic testing, or PGT, possible, which can screen embryos for serious genetic diseases. It's also absolutely crucial for fertility preservation. Think of someone facing cancer treatments who can freeze their eggs or embryos for the future. And it can offer real, tangible hope for those who've been through the heartbreak of recurrent pregnancy loss.
Okay, let's jump into a section I know a lot of you are probably waiting for. We're going to tackle some of the biggest, most common questions people have about IVF, and we're just going to give you straight, clear answers. This is usually the first question on everyone's mind, and it's so important to be real about it. The honest answer is no, IVF doesn't guarantee a pregnancy. Success is a really complex thing, and it depends on a ton of different factors. So one of the single biggest factors is age. For someone under 35, the average success rate per cycle is often around 40 to 50%. But for someone over 40, that number is closer to 10 to 20%. And of course, things like the specific cause of infertility, the quality of the embryo, and your overall health play a huge role too. And please remember this, so many people need more than one cycle to succeed. That is a totally normal part of the process, not a failure. Okay, next big question. Is it safe? Safety is obviously the #1 priority for everyone involved, so let's talk about the risks. The short answer is yes. IVF is generally considered a very safe medical procedure. Clinics have super strict protocols, and they monitor patients incredibly closely to keep risks as low as possible. But like any medical treatment, it's not totally risk-free. There's something called ovarian hyperstimulation syndrome, or OHSS, which is a rare but potentially serious reaction to the meds. There's also a higher chance of twins or triplets if more than one embryo is transferred, and a very small risk of an ectopic pregnancy. Here's something you have to know. An IVF journey is never a solo flight. It might feel deeply personal, but it is 100% a team sport. It takes a whole crew of dedicated, super specialized experts to guide you through every single step.
Think of it like this. You've got a whole crew in your corner. The captain of your ship is the reproductive endocrinologist, or REI, your main fertility doctor. Then you have the brilliant embryologists, the scientists in the lab, taking care of everything. You'll probably talk the most with the amazing nurses and coordinators. Plus, you've got ultrasound techs, andrologists for the sperm side of things, and often genetic counselors and mental health professionals who provide that absolutely crucial emotional support. It's a big team.
So, as we start to wrap up here, let's zoom out and look at the big picture. After all this information, what are the most important things to really take away about IVF?
If there is one single thing to remember from all of this, it's this. IVF is not a one-size-fits-all deal. Seriously, no two journeys are the same. Every single treatment plan is highly personalized, tailored specifically to a person's unique biology, their history, and their needs. It is the definition of personalized medicine. When you step back and think about it, IVF is just incredible. It's this powerful technology that is always evolving and getting better. It has completely changed the landscape of family building, opening doors and bringing hope to literally millions of people all over the world. It's a real testament to science and that deep human desire to create a family. Of course, it's really important to remember that this entire discussion is just for educational and informational purposes. It is not in any way a substitute for real medical advice. For that kind of personal guidance, you should always talk to a qualified doctor. If you'd like to find more information on the whole IVF process, you can check out the portal ivfforme.com. That's ivfforme.com. And that leaves us with one final thought. As science and technology just keep pushing forward, breaking new ground, what do you think the future of building a family is going to look like? It's a pretty exciting and hopeful question to think about, right? Thanks so much for joining us today.